Hi, Dr. Dominic here, Elite Facial Plastic Surgery. I hope you're doing well, and I'm coming to you today from my operating room just to mix it up a little bit. Today, I want to talk to you about a neck lift. And many times patients are coming in because when they hear the term neck lift, they think of different things that are going to be addressed. And in my hands and my training, when I'm talking about a neck lift, I'm really talking about this central area here in the neck. And the reason why is the neck lift can involve the jaw or the jowling here. It can also involve the submental area. So what I tend to focus on the neck lift is really addressing this midline area. And what that's meant to do is address fat here, and that can be done with the liposuction component of the procedure. But then there's also a muscle called the platysma. And the platysma is a sheet-like muscle that starts on your clavicle, and then it comes all the way up, and then comes up and over the jaw, and then blends in with a muscle/fascia layer called the SMAS. That's the muscle that's normally tightened when we're looking to address the neck lift. The incision that we utilize to accomplish that, and again, and this is my practice, is you make an incision underneath the chin here. And normally that incision can be 1.5 to 2 centimeters. And what that allows us to do is do the liposuction. And then the other component is tightening up that platysma. So that way it cinches up and corsets it and makes it more defined to accentuate that neckline. With that, and when you're done with it, you usually put some sutures coming across. Now, if you're looking to just enhance this area here, sometimes a neck lift would be a good option. And the reason why I say sometimes is because it's not a one size fits all. There are many things that enter into the equation, and that's where having that initial consultation is so important, because it allows myself or other surgeons to understand what they're looking for and to also to assess things. What's important regardless of that interaction is going to be age, elasticity of the skin, because sometimes patients may think they want a neck lift because they're focusing on the jowls, but in actuality, you got to start thinking about doing more of a face lifting procedure. And the reason why is the jowls sit along the jaw here. It has to do with laxity. And normally the facelift, you got to pull that SMAS or muscle layer to get this more, quote, tighter and refined. And that's done by making incision up here into the hairline and behind the ears. And I'm not going to go into it, but there are other videos that I describe the facelift procedure. But it's very important for you to understand what what procedure can achieve, what it can do. But you got to talk to the surgeon so they can understand that. Now, you can blend a neck lift with a facelift to address both. It's really up to you and what you're looking to achieve. With that, I'm sure one thing you're wondering, is a neck lift painful? And the long and short of it, it should not be painful. It's more soreness, as most procedures are in facial plastic surgery. But again, every patient is just different. But I would say the majority of my patients just take Motrin or Advil to help manage their discomfort, and occasionally sometimes need pain medications. After the procedure, you will be wrapped up in what I describe as like a human Q-tip. And what it's, you'll see is basically your eyes and the outline of your cheek, and then your jaw and your mouth. And usually that comes off when you follow up with us after a couple days. And then at usually post-operative day 7, we take the sutures out, and then we have you wear an elastic garment for a couple hours during the day, and we sleep the night for another week. So I hope that kind of shed some light on a neck lift. If you're interested in the facelift, again, I have other videos on our channel to describe that. I hope this helps to answer some questions. If you have any questions at all, give us a call here at Elite Facial Plastic Surgery. Take care.